Hi, hello. Every person, whether healthy or unhealthy, regardless of their current physical condition or age, truly needs to do some form of exercise regularly in their daily life. You see, exercise is like a great medicine, a wonderful remedy which works for all kinds of diseases, ailments, and health conditions. And it is the only medicine that the more you take, the better it is for you, and it has no side effects at all, which is truly remarkable and unique. So even people who have kidney disease or any other chronic illness should do some exercise every day as part of their routine. They should exercise even if it is just a little bit or only for a short time. Among all exercises, the best one is yoga, which is known for its gentle movements and holistic benefits for both body and mind. But before doing yoga, you must pay attention to a few important things. For example, when you do it, and how you start is very important for your safety and effectiveness. Before starting yoga, pay attention to these things. Number one is to do warm-up exercises, which help prepare your body and prevent injuries. Number two is also to do warm-up exercises because warming up is so important that it deserves to be mentioned twice. Some warm-up exercises, which our yoga instructor will show you how to move your hands, move your head, stretch your neck, and so on, are essential. After doing these warm-up exercises, you can start yoga with more confidence and less risk. Number two is that you should practice yoga on an empty stomach about 2 to 3 hours after eating a meal, and you can drink water if you need to stay hydrated. Proper hydration or having enough fluids in your body is important for your health for doing yoga safely. Before starting yoga, make sure to get your health checked by your doctor or healthcare provider. Your doctor will tell you how much and how long you can exercise, do physical activity, or practice yoga based on your individual health needs and medical conditions. Still, I would say that those who are suffering from kidney disease should do any yoga slowly and gradually, taking their time and listening to their body. Do it slowly without rushing or forcing yourself. This way, your body will not be put under too much pressure or strain. If you notice that any exercise is making you feel tired, uncomfortable, or causing you pain, then stop that exercise immediately and rest. So before doing yoga, make sure to take all necessary precautions and follow the advice of your doctor. If you do yoga with precautions and with care, there is no better exercise on earth than yoga, which can benefit your body, mind, and spirit in so many ways. Truly, yoga is a gift to your overall well-being, and practicing it with mindfulness and attention can make a significant difference in your life. Remember, consistency and patience are key, and over time, you will notice positive changes in your health, your energy, your sense of inner peace. With regular mindful practice, yoga can become a source of strength, balance, and tranquility, supporting you not only physically, but also emotionally and mentally throughout your journey to better health.
Those who have kidney problems, whether they are on dialysis or have had a kidney transplant, need to practice yoga regularly. There are certain asanas such as breathing exercises, mandukasana, bhujangasana, shalabhasana, and along with these yoga postures, there are also some kriyas. There are hand kriyas, knee kriyas, back kriyas, which help move the spine as well. They should do all these things. There are also mudras like Apanvayu Mudra, which is especially beneficial for kidney patients. For those who have had a kidney transplant or those who are on regular dialysis 2 or 3 times a week, if they do even one of these kriyas, they will definitely be able to lead a healthy life. First, let's do the knee kriya. You see, people with kidney problems often have knee pain, joint problems, and difficulty walking. So if they do this kriya, their knees and kidneys will both stay healthy. First, we will sit on a mat. When doing yoga asanas, you should not sit directly on the floor, but on a mat. This is because our body is bioelectric, and if we sit directly on the ground, there is a chance that our body's energy will transfer to the earth. So always do yoga on a mat. Sit on the mat, keep your back straight, place both hands on your knees. Or if you have special discomfort due to kidney issues, you can place both hands behind you for support. If you put your hands behind you, it will give you support. Some patients may not be able to keep their hands on their knees like normal people, so they can keep their hands behind for support and keep their feet together. Keep your feet together. Now slowly move your feet forward and backward. Move them slowly forward, then slowly backward, all the way forward and then all the way back. But keep in mind, keep your feet together. Don't let them separate. This way, the big joint in your hip will stay active, and as you walk, all the strength in your legs will be maintained by this kriya. Now stop this movement and rotate your feet to the right. Move your feet to the left and right, but keep your feet together, toes together. The little toe should touch the mat. Do this movement slowly. This will increase flexibility in your legs and feet. Now make circular movements clockwise. Slowly rotate your feet clockwise from right to left. Watch carefully. We are showing you this Kriya. Do this 5, 7, 8 or 10 times at most. Then do it in the opposite direction, anti-clockwise from left to right. This way, even though kidney patients cannot walk much, by doing this movement at home, their feet, hips, and all the joints will stay active up to the knees. Everything will remain active. Relax, take a little rest, open both knees, place your hands behind you, relax your legs, let them fall to the left and right, and breathe normally. Now we will do another Kriya together. Please bring both of your feet together and then gently stretch both of your legs out in front of you. Next, very slowly bend your right knee and carefully place it over your left thigh. Firmly grip your right foot with both hands, making sure to keep your left leg straight. Keep the foot in the correct position. Pull it forward just a little bit. And remember, only move the knee, not the rest of your leg. What do you think will happen when you move the knee? No, the joint at the base of my right thigh, that is, the hip joint where the thigh meets the pelvis, has become tight. Because of this tightness, I can't activate it fully or make it as active as I would like. This is a very beautiful Kriya, a yogic practice that helps bring awareness and flexibility to this area. Now grip your right knee. Hold it with both hands, making sure your grip is firm but gentle. Interlock your fingers around the knee to secure your hold. Grip and hold the knee, feeling the connection between your hands and your leg. Bring the knee close to your chest, drawing it in as much as is comfortable for you. Keep it on the right side of your chest, not letting it move toward the center. Turn your head completely to the right, allowing your gaze to follow. Don't let your hips move to the side. Keep them steady and grounded. You can do it. Take your time and focus on the sensations in your body. Then bring the knee down again, applying gentle pressure from above. Bring the knee down to the side, feeling the stretch in the hip area. Then bring it to your chest again, maintaining control. Then bring it down. Repeat this movement, bringing the knee up and down several times. In this way, my joint is getting more active and responsive. It is becoming more flexible and mobile. My flexibility is increasing and my right thigh is becoming more supple. This movement also affects the kidney. When you press the knee to the chest like this, the right thigh gently presses on the area where the kidney is located, stimulating it. As a result, my kidney remains active and its function is maintained. In this way, you can repeat the movement or do it properly, focusing on each repetition. Now place one hand under the knee and one hand under the sole of the foot, supporting the leg. Just like a mother rocks her child in her lap, move the right leg to the left and right, creating a gentle swinging motion. Swing the leg from left to right and back, keeping the movement smooth. By swinging, there will be activation in that area. The kidney at the back in the pelvic region will be affected and remain active. Besides, the joint will also remain active. Now, under the right knee, hold the grip firmly and do cycling movements with your leg, lifting it up fully. This helps get rid of the cold in the Nepali winter. If you do this kidney exercise regularly, it will be very beneficial and you will feel relief. If you do it every day, it will help you get rid of the cold. At the minimum, do this 7 times. Purul Ashok Adhikari, who comments on technology and lost weight due to depression, does jogging and running 6 times. If you need to meet regarding agriculture, do it once a month at night and it will be almost complete. I rest below the hill just like the students for the sake of my intestines. Whether it's illness, pest, or the noise of trucks, it's all up to the fate of the road department's basket or Duba's arrow. As for the stone, it might be the base of the group's leaf held with both hands, or it could be just soil. And the spinal flight backbone stays airless in Laprak. Today, I have reached a level of art but as a pedestrian. In faith, the horse's thread, along with the students, is twisted and turned like the heart's own making. Some have the courage to put up a note on the first floor by Gautam. At the right time, some have quietly bought their own hill with lies, and as a result, the cause of that bomb's revelation is indebted. Now, here, you should gently and carefully hold your hands with your fingers and then hold your feet with your hands, making sure your grip is always comfortable and secure at all times without any strain or discomfort. The potter's trowel is like a potter's trowel, smooth and steady in its movement, just as it should be, always consistent and even, never hurried. Just as the mother used to shake the clay with gentle rhythmic motions, so do all the actions with normal, relaxed breathing. Do not hold your breath for even a few seconds, and do not let it go abruptly or forcefully. Do all the actions with normal, steady breathing. Maintaining a calm and even rhythm throughout the entire exercise without interruption or haste, allowing your body to adjust naturally. Ever hold both hands and do the cycling of the antlers and the antlers, moving them in a circular motion as if mimicking the graceful movement of antlers in the wind. You will see a beautiful action, a flow of movement that is both elegant and beneficial for your body and mind. Here, for our kidney patient, this exercise is very necessary and important. That brother is undergoing dialysis, taking admission in the bed, sitting on the bed, and doing it through this method. He used to do it faster than the outside because he gets more concentration from the outside environment. He used to do the opposite as well. If he went up, he would return to the current downwards, always maintaining balance and control, never losing focus or composure, always attentive to the process. The same action is done by the feet, hands, head, and below the navel, which are our kidneys, pancreas, and liver. If one remains active and engaged, then he himself will lead a happy and beautiful life, full of energy and positivity, enjoying every moment to the fullest with a sense of well-being and contentment. Autiyu is a simple act, which means that the mother butterfly or the creator will speak to the mother Prajapati Rena tomorrow. That mother butterfly is called the seat, a place of rest and transformation. The present butterfly seat is called the seat, a symbol of stability and peace. He would break the two hands of the god, symbolizing release and freedom. He would make the two feet one, uniting them in harmony. The body of the cow would turn like a wing, moving gracefully and smoothly. He would grip it with two hands, hold it with 2 feet, and move it with 2 fingers, coordinating all parts together. When the creator moved the seat, he would move his 2 hands accordingly, following the rhythm of creation and movement in perfect harmony and balance, always in tune with the flow. This posture is a good one for our excretory organs, supporting their function and health. Because the excretory organs are in a state of flux, the kidneys are an important organ inside them, playing a vital and essential role. If they become inactive for any reason, they cannot function properly, so the body cannot properly expel foreign substances from the body. But with this exercise, all the foreign substances from the body can easily pass through the excretory organs, and we can remain relaxed, comfortable, and at ease, feeling light and healthy, and free from discomfort or tension, enjoying a sense of relief. Do this one exercise regularly, making it a part of your daily routine and practice so that you can experience its benefits over time, gradually and steadily. Keep both hands on the floor, press the weight slightly and release them slowly, feeling the gentle pressure and release. Press slightly, release them slowly, maintaining control and awareness at every step, never rushing or forcing the movement, always being mindful. This is the result of our ankle joint, which is good for the nerve joints, which is tight, gradually flexible, pliable, and more mobile. As a result, all our work, all actions are easy, convenience is easy, and we live a beautiful, harmonious life, full of comfort and ease, enjoying every day and every activity, appreciating the improvements. Ever used to straighten 2 gods, take a rest. He would open 2 gods, put his hands behind his back, rest karibe. Writing is all action, take a rest, and solitude is necessary. It is necessary to exercise the body, and it is easy for the body to reach the body. Amme is more active, more awake, more aware. Hoy pariba, abang beautiful, slow life kari pariba. Now you see, you are a kidney patient. Amar tinoti is the main joint in the wrist. One is amar maniband, kachoti ba wrist, kahu, che, ortina kohuni orla, kand. Tinoti joint should be kept right, aligned, and healthy. Ring manu kimte active rakiba, setihi bela kitu gudiay kriya kriya kariba. Abe would keep 2 hands in front, palms open. He would open the ring ball completely, stretching the fingers. Sas would open the ring, expanding the hand. In Mutha art, all the 4 fingers of our old finger would be placed and open, spreading them wide. Open your mouth, open it, breathe deeply and calmly, at least 8-10 times. Repeat for best results and maximum benefit, allowing your body to adjust and adapt, feeling the difference. Hat zamana bulivani, hand full straight rahiba, only wristi agaw bhagata, amar manibandha kachoti ru agaw bhagata, round up hob, inside round karibe, making circular motions. Now reverse, turn outside inward, moving in the opposite direction. Write 8 and 10 letters outside and inside. Again, mouth inside, breathing calmly and steadily. Seta is fully active, engaging all muscles and joints. Now I am doing all the other work, feeling the benefits and improvements. If I am doing one action, I am doing it right, with focus and care, paying attention to every detail, never neglecting any part or step, always being present. Abide used to open his hands, spreading the fingers. Papuli, he used to mix the 5th thumb, coordinating all digits. He used to increase Papuli's salary, improving strength and flexibility. The same memory is the action of immortal wrist, a lasting benefit for the body, which you will appreciate and value, noticing the positive changes. Present Papuliko Lai Dindu, Anantu of shoulder, touch of shoulder, gentle contact. Puni Agu Gumaintu, rotating gently and smoothly. Ya follow ni Amar Kohani Pakerjo joint achita free rahiba, keeping the joint loose and relaxed. Amar Kohani flexible rahiba, maintaining flexibility and ease. Ame samat kama sahaje re suvida re kari pariba, making all work easy and convenient. So a very beautiful verb found in Kohani and Kriya Kariba, a graceful movement and action which brings satisfaction and joy, enhancing your daily life. Tati. Abe, the 2 hands join the ring and mix it, creating a circle. He would put it on the shoulder, resting gently and comfortably. Next, the elbow misandu, connecting at the joint. Slowly, the elbow behind the elbow, the upper one, moving with care and attention. Jet bado sarpol parip, so slowly karibe, repeating for best effect and benefit, always being mindful and attentive, never rushing the process.
I did normal breathing, focusing on calmness and relaxation. When I was a kidney patient, I stretched my hands and feet, and then my hands and feet went up and down, moving rhythmically and gently. As a result, my kidneys were fully active, and the rest of my body was active, energized, and refreshed. I did this exercise outside, enjoying the fresh air and natural surroundings, which was very pleasant and uplifting, adding to the overall experience. I decided to do this exercise after I had determined the pressure on my kidneys, understanding my body's needs and limits. Now do it the other way around, reversing the movement. Do it inside and out, alternating directions for balance. What I did, what I said, do the opposite, balancing both sides. Is it possible to reverse the direct action? Yes, with practice and attention, it is possible to master both directions, ensuring a complete and balanced exercise routine for your health and well-being, and achieving the best possible results for your body and mind.
There was a net in the middle of the round where only the outer nerve was active, and in contrast, the inner nerve was reactivated in a different way. As a result, after the fire, both sides' nerves became active, so we have to keep them fully active. Keep your hand down. Place your hand on top. Now, how many times did you do the movements of your feet and hands when you were going to die? At present, the most important movements are those of the neck. To keep the neck in good condition, to keep the thyroid, parathyroid, and the pituitary gland at the base of the skull active, we need to perform neck exercises. Slowly bend your head forward, touch your chin to your chest. Then slowly, very slowly, tilt your head backward. Rest the back of your head on your upper back and look up at the sky with your mouth open. Slowly bring your head forward again, and then slowly tilt it backward. In this way, move your neck forward and backward at least 4 to 5 times. For those who have kidney pressure, those who have had a kidney transplant, or those who are on dialysis, you should do these exercises regularly at home, even on your bed. If you do them in the garden or on a terrace, it's even better. Now, slowly move your neck to the right. Bring your right ear close to your right shoulder. Then, to the left, bring your left ear close to your left shoulder. In this way, move your neck left and right. Do this at least 4 to 5 times. Because if the mind becomes inactive, we become susceptible to various diseases. To keep the body active, to keep the body energetic, these are excellent exercises. Relax. Now, make a circular motion. Slowly rotate your neck from left to right. This is a clockwise rotation from left to right. Do this 4 to 5 times. Only those who have high blood pressure should not do this neck rotation exercise. Neck rotation is not recommended for them. Now do the opposite, from right to left, anti-clockwise. Do this at least 4 to 5 times, because if people with high BP do this, they may feel dizzy, so they should not do it. If you do it, it's better to keep your eyes closed. Why? Because if you sometimes feel dizzy or nauseous while doing this exercise, closing your eyes will prevent dizziness or nausea. This is a very good exercise. It keeps all the parts of your neck and head active. When the thyroid, parathyroid, and our glands are healthy, the body's internal balance and all other glands can function properly. Relax. Now, we will perform a gentle stretching exercise together. This is what we call an asana in yoga practice. When practicing yoga asanas, we will do a yoga pose while lying comfortably on the mat. Please lie down slowly and carefully on your back, making sure you are relaxed and at ease. Keep both legs straight and fully extended. Keep them together, side by side. Place both hands gently beside your head at shoulder width and keep them aligned accordingly, parallel to each other. Inhale deeply, and as you do, stretch both legs downward and both hands upward as much as you can, feeling the lengthening in your body. Stretch fully, and as you inhale, imagine yourself like a tall palm tree, straight and strong, reaching up to the sky. In this position, our whole body remains straight and strong, just like the trunk of a palm tree. As a result, our kidneys, pancreas, liver, and stomach, all these important organs stay active and engaged. Exhale slowly and gently relax your body. Loosen up a bit, letting go of any tension. Slightly open your legs, allowing them to fall naturally. Relax your hands a bit, letting them rest comfortably. Return your breath to normal, breathing calmly and evenly. This is a relaxation position for now, allowing your body to rest and recover. The asana we just did is called Tadasana, also known as the palm tree pose. In Tadasana, like a palm tree, you remain straight and strong, with your inner self also straight and strong, rooted and stable. Especially the area below your navel and the excretory organs become fully active and stimulated.
the kidneys also become fully active and energized. Let's repeat it again, taking your time. Bring both legs together, keep them joined and aligned. Both feet are together, touching. Both hands are at shoulder width, parallel. Once you are fully in position, inhale deeply and slowly. Stretch your body in the opposite direction, upward and downward, from below the navel and above the navel, feeling the stretch throughout your entire body. Stretch in opposite directions, which will make all the organs in your body fully active and invigorated. The internal nervous system and circulation will be balanced throughout the body, promoting overall well-being and harmony. Exhale and slowly bring both hands back to their original position. Both. Now gently open your left leg to the left side, allowing it to move outward comfortably and naturally. Let it rest there, feeling the stretch and the release in your muscles. Relax completely, letting go of any tension or tightness in your body. After every exercise, it is absolutely essential to rest for a while because the energy flow in the body that occurs during the asana, like in Tadasana, needs time to settle and balance itself. This resting period helps your body absorb the benefits of the practice and allows your mind to become calm and peaceful. Now, we will do a pose lying on the stomach, which is also known as the prone position. Lie down on your stomach, turning gently to the right side for comfort and ease. Bhujangasana. Bhujang means snake or cobra. Like a cobra, raising its hood majestically and gracefully. Bring both legs together, keeping them joined and straight. Rest your forehead softly on the mat, feeling the contact with the ground beneath you. Place both hands straight at shoulder level, palms facing down on the mat. Keep your elbows close to your body, touching your sides gently and firmly. Now, slowly lift your head, just your head, so that the back of your head and your upper back are reaching toward the ceiling. Now, inhale deeply and slowly lift your chest, feeling the stretch along your spine and the gentle opening in your chest. After keeping both legs together, keep them joined and straight. The hands remain on the mat, palms down, elbows slightly raised off the floor. As a result of this posture, circulation improves from the head to the chest and up to the back, enhancing the flow of blood and energy throughout your body. This has a special effect on our kidneys, which are vital organs for filtering and cleansing the body. As a result, circulation in the kidneys improves, and the kidneys and all their cells become more active, so the kidneys can function better. Nowadays, kidneys are becoming more and more inactive due to lifestyle factors and stress. By practicing yoga, especially Bhujangasana, the kidneys will definitely gradually become more active and healthier. Even if it takes time, they will slowly become active and efficient. Practice this regularly and then slowly return to the starting position. Rest your forehead on the mat, relax your whole body. Bring both hands back to their original position and relax, letting your breath return to normal. Now we will do Shalabhasana, also known as the locust pose. Place both hands under your thighs, palms facing down. Keep your elbows close to your stomach, pressing gently. Rest your chin on the mat, feeling the support and grounding. Now, slightly adjust your position, rest your chin comfortably. Inhale, and now slowly lift your right leg. Only the right leg, keep it straight, do not bend it at the knee. Lift it as high as you can while inhaling, but do not strain or force the movement. In Shalabhasana, Shalab means grasshopper, which lifts one leg at a time, mimicking the movement. Similarly, slowly exhale and bring it back down, lowering with control and awareness. This also has a great effect on the kidneys. It can activate inactive kidneys, helping them regain their function and vitality. They can become active again, supporting your overall health and well-being. Now do the left leg. Lift your left leg straight. Do not bend it. Lift it as high as you can according to your capacity and comfort. Even people with kidney problems, whether on their bed, in their garden, on their balcony, or even if they are not admitted to the hospital, can do these asanas comfortably and safely. Slowly exhale and bring it down, feeling the release and relaxation. Remember, whenever you do an asana, there is an effect. Your body rises and responds. Inhale when lifting, exhale when lowering, and exhale when bringing it back down. Now we will do the same exercise with both legs. Bring both legs together, keep them straight without bending, and lift them up together. Keep them straight, feet together, chin on the mat, and maintain your breath. Very good. Take a moment to notice how your body feels and appreciate the effort you have put in. Notice the gentle rhythm of your breath and allow yourself to rest for a few more moments, feeling calm, peaceful, and at ease. You are doing wonderfully. Let your body and mind enjoy this peaceful, restorative time.
By doing this exercise regularly and with mindful, attentive awareness, blood circulation in our legs will gradually and noticeably improve. Also, in our spine and back, on both sides where the kidneys are located, both the left and right kidneys will become more active. Blood flow will normalize and vital energy will reach there, making them fully active and healthy. Slowly and gently return from the asana. Relax in Shavasana, allowing your body to settle and unwind. Turn to your right side and relax in Shavasana, feeling the support of the ground beneath you. After completing the asana, always rest in Shavasana for a few moments, letting your body absorb the benefits. Just as a corpse lies still and unmoving, in the same way, let your body relax completely and deeply. Keep both legs slightly apart, about 1 to 1.5 feet apart, with both arms at your sides, palms facing upward, and the whole body completely loose and relaxed. Breathe normally and effortlessly. Gently close your eyes, letting your eyelids softly meet. Calmly close your eyes, allowing your mind to become quiet and peaceful. Do not just sleep or fall asleep. Without sleeping with your inner mind, mentally observe your right leg and foot. See how beautifully and wonderfully God has given you this right foot. Then observe your right ankle, the sole of your right foot, your right knee, your right thigh, the lower part of your navel, where your pancreas and liver are located on either side of the navel, and at the back, below the navel, on either side of the spine, are your two kidneys. With your eyes closed, focus your attention there, feeling the presence of these organs. Observe your navel area, the right side of your chest, your right shoulder, your right upper arm, your right elbow, your right forearm, your palm, and all your fingers one by one. Then slowly move upward. Observe your palm, your right wrist, forearm, elbow, upper arm, and shoulder, noticing any sensations. Observe your right shoulder, back, and a little above, feeling the contact with the floor. With your eyes closed, see all this in your mind without opening your eyes, just visualizing. With your eyes closed, see what you can as clearly as possible. Nowadays, everyone looks at others, but today, look at yourself. Observe yourself with kindness and compassion. Observe your forehead, nose, right eye, right cheek, right ear. Then observe the right side of your forehead and the top of your head, feeling the shape of your skull. Now observe the left side of your forehead, left eye, nose, forehead, chin, left cheek, left ear, and the left side of your back, left shoulder, and left upper arm. Observe your left elbow, forearm, wrist, palm, and all your fingers, one after another. Slowly observe your palm, then your upper arm, elbow, upper arm, shoulder, left side of your chest where your heart is. Feel your heartbeat, the gentle, steady rhythm. Observe below your chest, your navel, the area below your navel, noticing the rise and fall of your breath. Observe your left groin, left thigh, left knee, left ankle, left sole, toes, top of the foot, and sole, feeling the relaxation spreading. By doing Shavasana, you get as much rest in half an hour as you would otherwise in a much longer period. Even 5 minutes of Shavasana can give your body as much relaxation and rest as a longer nap, especially for kidney patients who have to lie down a lot. Do Shavasana regularly. If you cannot sleep, do Shavasana and let your mind and body rest. Do not worry about anything at all. God has given you this body, and through yoga, you can definitely heal it and restore its health. Your kidneys will be fine, and you can live your life like a normal, healthy person.